Dr. Mike Waldrum, the CEO of ECU Health and the Dean of the Brody School of Medicine at East Carolina University. Good morning, Dr. Waldrum.
Good morning.
How are you?
Great.
Happy early Thanksgiving to you.
Thank you. It's a really exciting time.
Big day in Greenville, huh?
Yeah, really big.
This day's been talked about a long time. There's been a lot of effort put into getting this money. $265 million. Is that what this building's going to cost?
Yes, and I think it's just incredible. This doesn't just happen, and as you said, it's been in the works for a long time, and it's happened over multiple stages, but it's so exciting. On Rural Health Day, we're cutting the ribbon, and we're so appreciative of President Hans, the Board of Governors, the Board of Trustees of ECU and ECU Health, and the Chancellor, and all the work over many years to make this happen. Mm-hmm. And so the original appropriation was $215 million. And then because of inflationary increases in the last session, we got a $50 million increase to build this facility, which is going to be great. And it's so important because it just enables us to continue to meet our mission, which is about rural healthcare. So it's great to have these two things coming together in the same day. And we're so excited about it. You know, I was just reflecting and listening to the show about football, and I always make the analogy, having a facility like this that's built for our faculty and for our students to support them will help us recruit great students that want to continue this great mission that we have at ECU, Brody School of Medicine, and it will help us recruit faculty, which we have done a great job here. You know, we're also looking at the third birthday of the creation of ECU Health. Record recruitment last year, the most doctors we've ever recruited to Greenville, 200 new physicians.
Yeah, we had Brian Floyd in here last week talking about all the doctors that have been brought in last year. That's amazing.
Yeah, so I'm just so appreciative of all of that, right? So the legislators, the Board of Governors, President Hans and the Chancellor, our faculty, all these doctors, nurses, technicians, and what we do to provide excellent health care to this great rural region of Eastern North Carolina. So it is a day of celebration for us, and we're so excited about that.
You know, it strikes me that we are somewhat fortunate that we got that money allocated last year in the budget, because if you think about what's going on at the legislature this year, it's going to be a much different year for allocating money. Because of the hurricane relief stuff, they just allocated another $50 million yesterday. We're now up to $1 billion in state funds going to Western North Carolina because of Hurricane Helene.
Yeah.
I guess the timing finally worked out for it. And people should also be aware that, you know, this has been in the works for 10 years or more.
Yes. Well, I think that you've said so much there. One, we always have to, reflect on what happened in Western North Carolina and the devastation that happened there. And I don't think a lot of people in Greenville know this. I was talking to the Secretary, Cody Kinsley, last week, and how appreciative he was of ECU Health and our teams. We sent mobile units there. We were providing support to those communities. And so that's what we do in healthcare, and that's what we do here in the East. And so it was fortunate timing. But I think, you know, as we reflect that being where we are here in Eastern North Carolina, you know, I always say I've been here for 9 years now, and we've had two 500-year hurricanes in that 9 years. So we know, I mean, it was different in the West than it is the East. We're a bit more used to it, but it does cause significant disruption to society and to the communities and to healthcare when that happens. And so we can empathize, you know, pretty fully with that. But the timing is everything. And, you know, as with the creation of ECU Health, the timing, you know, there's a lot. It always, things work out, you know, but I think it's really having perseverance on what's the right thing, what's our mission, staying true to your values. And that's what we did over time. So appreciative of the President and the Chancellor again, and all of us coming together, creating ECU Health, which led to us coming together to get this funding. And it's going to be such a great facility. The design has happened from the faculty and students, and it will build on the culture that is this great culture of the Brody School of Medicine, and the work we do, which is really community-based work. And there's no higher value medical school in the country than Brody School of Medicine. So I'm so proud of that.
We talk about it all the time. Of course, those of us who've been around Greenville a long time. I was here when the med school was formed. I watched the fight to get the med school in the legislature. And, of course, Leo Jenkins has always been one of my heroes, and many of us who were around back in the 70s because of it. But, I mean, think about if it hadn't have happened, because the ECU, Brody School of Medicine, is educating the doctors for the state of North Carolina. We know there are other medical schools, but Duke, UNC Chapel Hill, they don't retain their doctors in the state of North Carolina. If we didn't have the School of Medicine here in Greenville, we would have a doctor shortage like crazy in North Carolina, because you guys are the ones that are putting the doctors in the state.
Well, so I want to correct you a little bit. They do train doctors that do stay in the state.
But not at the percentage that you do.
Yeah, we just have the highest percentage.
Yeah.
And so that's a really important thing, because it goes back to our mission, is what I was saying. And why I say we're the highest value medical school in the country, because if you look at doctors that do primary care and that stay in the state where the funding comes from to educate those doctors, there's nobody that does that better than Brody School of Medicine. And so we do provide doctors that take care of patients for North Carolina at a very high rate. And they tend to go to rural communities and underserved communities. So our tradition and mission is strong. And so this building will really help us build on that. And as I mentioned, just with the creation of ECU Health, we've been able to recruit more faculty and physicians to make that mission happen. But we're also building new programs to even increase that yield and that percentage. And so we've created rural residency training programs, which allows us to extend the education mission across the region into 3 regional hospitals. That happened because of funding. Primarily, Brent Jackson was very helpful in that. We created these rural residency training programs. 60% of the first 2 classes are staying in Eastern North Carolina, rural communities. So it's already showing. So we've only had 2 classes graduate. And so that's already creating more doctors for North Carolina, and specifically Eastern North Carolina and rural communities of Eastern North Carolina. So with ECU Health, we're really creating the model for an academic rural delivery system and education system for a region. And we're seeing the value of that already. And we're very young. I always call us a toddler. We're kind of bumping into the furniture. We're falling down occasionally. So we haven't figured it all out yet, but we are putting systematic solutions into these really important issues that help our communities be healthy and our state be healthy. So I'm so proud of our faculty, and I'm so thankful for the support that we have from our legislators and our governance and leaders across the organization.
You know, what I wanted to ask you, Mike, was how it's going for you, because, since the restructuring of the hospital relationship with the university, and the fact that you were named as both the dean of the School of Medicine and the CEO of the hospital system, that's a big job. How's it gone for you? How is the merger? I guess we can't call it a merger. They didn't like that word much. But how is the new relationship gone, and how's it going for you, having to wear both hats?
Well, I'd be interested in your perspective on that, Henry. But
well, it looks like it's going great to me. But
well, I mean, for me, I think it's just unbelievable. As you know, I was recruited here to do this.
Right. Did you have the same position at the University of Arizona?
Yes. The structure was a bit different, but the dean reported to me.
I got you.
I was the CEO over it. And so the titles and stuff. And so the structure we have now is essentially the same structure, because we have a great executive dean, Dr. Jason Higginson, who unfortunately says he couldn't be here this morning. He sends his apologies for that.
We'll get him on later.
Yeah, but Jason is a great leader, and he is the dean of the School of Medicine, essentially. But he's on the team that all reports up to me. So we're all together in driving the tripartite mission we have forward. And so, as you know, I was recruited here to do this work, and the first attempt to do it for a lot of reasons that I'd rather not talk about, it didn't happen, right? And
we tried,
right? And we tried, and it's been a discussion for 40 years, frankly.
Yeah.
But finally, because of the support again I always say these things just don't happen. Perseverance, the right thing to do, but the president of the university system, Peter Hahn's support, and Philip Rogers, myself, and others, and our respective boards coming together and saying what's the right thing to do. And so we worked through those really complicated issues, and we created ECU Health. And as I mentioned, it's still a very young company, but it's really doing well. And I'm so optimistic, and I see it happening. And so this potential that everybody's been talking about for 40 years is starting to be realized. And so whether it's the recruitment of faculty, increasing our students' class size, and back to this building, right? So just that, getting the funding for that, not only is it this great building and the ability to attract more physicians and educators, but also we're growing the class size. So that yield we talked about, we're going from 80 to 120. Well, we got funding for that.
Now, is that 120 admissions for over a 4-year period?
No, per class.
So 120 per year.
Per year.
Okay.
So we're going from 80. Right now we've been growing it slowly. We were at 80.
We'll have like 500 students at any one time in the medical school.
Right.
That's amazing.
Yeah. So that, and we're funded for that. So appreciate that. But this, bringing what I call the academic organization together, those three missions, and creating what I call the academic flywheel. So research, education, and care, they all go together. And as I mentioned, being able to extend that out to our rural hospitals, so many of our physicians in Ahoskie or Dublin want to have students there. And that helps us support those communities. And so we're building those systems, and we are becoming the model for academic rural health care and education, and we're building that. So it's really exciting time. And the importance, and I'm so appreciative of not just all of our nurses, doctors, and caregivers, but the people that educate, our educators, and then the people that are doing research, because all three of those missions really do feed upon themselves and are so important in creating and building on the legacy that is Brody School of Medicine and these respective two organizations that have done that separately. But now we're doing it together, and it allows us to build on systematic solutions to these things to improve them over the long term. And importantly in that, it's not just the health system and Brody coming together as dean. So I'm now, because I'm dean, I get to work with really great people, the other deans in the health sciences campus. And we have a great, School of Nursing, Allied Health, dental school, our library. I mean, we have such incredible assets. And so we have I'll just one example of that. The state's largest nursing school is in Greenville, North Carolina. The highest pass rate of 100% NCLEX pass rate.
Yeah.
And so this
my wife and daughter both came through that program.
Pirate nurses.
I can tell you how difficult it is.
Yeah. Well, so working with them.
Yeah.
Now we're together, and we say, okay, well, let's build on that.
Yeah.
And so how does the health system support your schools? And so we're starting to do that. Our new chief nurse executive, Dr. Bays, and Bem Akintadi, the dean, working on programs to say, how do we invigorate that, put in new programs to support North Carolina and Eastern North Carolina. So we're just starting to do more of that work. But that'll build over time. And so that just gives you, so all of that just gives me optimism, because I like solving hard problems, and I like being with these kind of professionals that are dedicated, that are willing to address hard issues and do the right thing for our communities and our state. And so it's an exciting time for me.
Let's go back to the building I don't want to run out of time here. We got about 4 minutes left.
Okay.
the new Brody School of Medicine building that the ground is being broken on today, when I hear you talk about, I mean, we got so much to be proud of at ECU. I mean, we're educating the doctors and the nurses and the dentists. It's just amazing what's happening in Greenville. And, of course, it's a huge boost also to our economy in eastern North Carolina, which we need. But what are you most excited about with what's going to happen today with this new building?
Well, today, specifically, we're going to have a party. And I'm most excited about the design of the facility.
Yeah.
That supports our students and our educators, and the new technology in it. It's just an exciting, the technology, and it's incredible.
If you walk through the old Brody School of Medicine
Yeah.
and you see the wood paneling on the walls, I remember when we were we were bringing some of the politicians in. We had the Speaker of the House, and I remember saying to Tim Moore, Tim, look at the walls. It looks like something from a 1960s sitcom in here.
Well,
you know?
back to what I'm excited about is building on everything that I mentioned, and I will say, just from an economic perspective, you know, having a construction project is big, but also, like I mentioned, recruiting 200 new doctors that live in Pitt County, that alone is big.
Yeah.
And this facility will allow us to do more of that, because it's like it's why I made the football comparison. You know, I've been at the University of Alabama and at the University of Arizona, and I know what we did there, and I am on the board of the AAMC, and I know what all academic organizations are doing. And it's just like football. If you got to have the NIL money, but you also have to have the facility if you're going to get the horses.
Yeah.
And it's the same in healthcare and in education. And so this will allow us to build a facility that makes us competitive in that market, because ECU Health is a national brand, and we compete in that market. We don't compete in eastern North Carolina. We compete across the nation, and we are bringing doctors and nurses and people across the country here.
And we're winning.
Yeah, and so it's that. So this is just another. It goes along with our great cancer center, the Smith Cancer Center, and you know, they're just these tradition of these great leaders that and community members that have come forward to do things, to work together. And it's not any one of us or them. It's all of us working together to do what's right for a region that needs us to do that. And so that's what this.
For it. God bless you.
And actually, you know, I know we're going to run out of time, but if you look in that paneled hallway, what makes me excited, I always talk about this, the picture of when they conceptualized the Brody School of Medicine. It was a field, and you have all these community leaders and doctors standing in a field.
Right.
And kind of coming out of the field is this building. And to me, that's emblematic of what we're all about here in eastern North Carolina.
I got a minute left. Any final comments?
No, we just appreciate the community's support and understanding of our growth. There'll be some growth pains in building this building. Obviously, having a new facility, I really appreciate the patience of our faculty and our students, because it is growing pains. We're going to go through a painful period as we build this incredible facility.
When will it be finished, by the way?
August of 2027. So
we're 3 years away.
Yeah, a little less than 3 years away, and but that's incredible, right? To build a building that large. It's designed, and you'll see renderings of it this afternoon. It's it's beautiful.
I'll be at the groundbreaking. I'm looking forward to it. Thank you for coming in.
Yeah, thank you.
Good to see you.
Good to see you. Great to see you.
We appreciate all that you do.
Thank you.
And God bless ECU Health, and thank God for it. You know, we're so fortunate to have it here.